Hey there, I'm Dr. Tingle. I see we have you in for a face exam today. Tell me what's going on. Huh, you say your face is crunchy. Sure it's not just dry skin, or maybe you slipped on your pillow weird, got a couple, creases in there. No, it's crunchy. Do you mind if I just touch around? Alright, cool. So I'm just going to you let me know if anything hurts, okay? Oh, I see. Can you give me a smile? Just go. Huh. Gonna see if it reacts the same if I use a brush, you know what I mean? So let's just try that. It's a little softer. Okay. Now if I just use the back end. Okay, so it seems the firmer the touch, the more crinkle response we get. So I'm just gonna take a few quick measurements with my calipers here. So just hold still for me. Okay, let's get that set about there. Good. Alrighty. Okay. Just gonna measure this little crunchy spot right there. Okay. And then there was this one over here. Okay. I know there's more. I was just looking to see how large we're dealing with, but I am going to draw on your face a little bit if you don't mind, okay? It's going to be just fine. I'm just going to mark out the crunchy spots. We're going to work on smoothing those out for you today and get that face all nice and smooth and not crunchy anymore, alright? Alright, just hold still for me. I'm just going to draw on your face. Just work out the crunch spots. Don't worry about it. It'll come off. There's one right here. Yeah, that one's gonna be a little bit tricky. Alright. And okay. Alrighty. So I think we know what we're working with here. So what we're gonna do to smooth out those crunchy, crinkly things you got going on in your face here. We're gonna do a few different things. One, we're gonna use our special little tool that'll help smooth out some of those crinkly spots. So all this does is use, some kind of weird internet magic, and it'll just smooth out a lot of those crinkly spots, okay? So just hold still for me. You can close the eyes if you'd like. And we're just gonna start working on a couple of these spots. It's a little less crunchy, okay? Very good. How you doing? You holding up okay? Alright, so just give me 1 second to work on this one on your forehead. Okay. Let me take a closer look with my light real quick and keep those eyes closed if you'd like. Just trying to see if we catch any shadows. I'm not going to shine it right at you. Just looking for any signs of those crinkles in the spots we just worked on. Yeah, still some more work to do there. Alright, just keep those eyes closed for me. We're just going to keep working. So you can see and hear how it smooths itself out. We're still going to have to do the deeper therapy too. Good. And just over here. Good. Good. You're going to feel much better, a lot less crinkly. Alrighty, let's just go and give your face a little bit of a brush. There we go. Help smooth out the crinkles. Now, that can be very comfortable trying to sleep with all that crinkly going on. Every time you turn, you must just crinkle, crinkle, crinkle. Alright, good. Alright, let's just blow off some of that. Any little excess we got going on. Good. Okay. So now we're going to do a little chiseling on your face. Don't worry, it's not going to hurt. It's going to feel like a nice relaxing massage. This is really going to help us get in there and bang out those crinkle spots, okay? Okay, just close those eyes for me and relax. Good. Okay, just going to use this to just good. This is just gonna help keep smoothing out those crinkles. You got one on your chin there. Oh, that's pretty stubborn. So we're just gonna come in here and give that a few good whacks. It's kind of like, sculpting stone. Since it's your pretty face. I shouldn't say that because it's not professional. I'm a doctor. Or at least, pretend to play one on the internet. Okay, dokie. Alright. Good. I'm just gonna take a look at your face real quick. Oh, good. Not so much crinkliness and crunchiness going on anymore. Good. Open your eyes for me. Good. I'm gonna run you through a pretty quick exam too, just to make sure everything is all good. You got that crunchy face. Alright. Get in there and do a little detail work now with my acupressure tool. So what's going to do, I'm going to go into the crinkle like that, and I'm going to wiggle it around. And it's going to help it release that crinkle, okay? You can just close your eyes for me. Just relax. We're just going to come in and just poke and wiggle. You're going to be A-okay, I promise. Yeah. It's kind of like getting all those knots at your muscles, except at your face. So maybe don't frown so much. Life's too short. I mean, unless you're doing the whole here for a good time, not a long time thing. In that case, I suggest you live by the adage of live fast. Let me get this up here. Die young. And leave a sexy corpse. Why not, right? Let's get this one here. These are really kind of jammed, huh? Sorry. Get them all worked out. Okay. Do a... apparently my light doesn't want to work again. Give me a second. I need to grab another one. Well, since we're going to give you an exam anyway, I'm just going to use my ophthalmoscope here. I'm just going to check for some of those shadows that we were looking for earlier, the crinkles. So make sure we got them all before we give you a little thorough once-over exam, just to make sure everything is copacetic. Alrighty, so I think we got a smidge more work to do, just a teeny tiny little bit. So we're going to go back in with the smoother, and we're just going to go smoothing. Just smoothing it out. Smooth. Here we go. Prettier by the stroke. I'm just kidding. Yeah, of course I'm a professional doctor, I swear. Good. Just gonna get a couple more of these little spots that were a little bit stubborn earlier. Okay. Alrighty. Let me give you a once over again. I'm just going to look at that face. Looking for any more crunchy spots. Alright, if I just grab your face like this. Just gonna shake it. No? Okay, good. I'm gonna squeeze your face. No crunchy. Squeeze your face. No crunchy. Squeeze your face. This way. No crunchy. Good. Alright, I'm gonna poke. Nope. Poke. Good. No more crunchy spots. That's very good. Well, I guess we should give you a little, like, once-over exam, huh? Alright, no, I swear, I'm a professional doctor. Relax. Let me, I think I forgot something. Let me grab that real quick. Alright, well, looks like we got that face all uncrunched, but I think I'm going to just do one more thing. I'm just going to smooth it over with this roller. Just make sure we really got everything out of there. So just relax. Just going to smooth you out. Go dot. Nose, close your eye. Other eye. Good. Okay. Smooth it up for me. Alright, let's give you a little exam. I want you to look right at my nose, please, real quick. Just gonna run that light by you. Okay. Good. Alright, now I'm gonna use my little occluder. That's what they call it, right? Yeah, occluder. And I'm just gonna swing the light in and out, and in and out, and in and out, and in and out. Just looking for that pupil dilation contraction. Right, yeah, okay, yeah. Alright, cool. And on the other side, same thing. In, out, in, out. Everything's good that way. Why don't we do a little peripheral vision test here? So what I want you to do is just look straight at me. You let me know when the fingers go out of view and into view, okay? Alright, good. Ready? Here we go. Good. Very good. Good. Pretty good, this. Alrighty, good job. Right, can I confuse you? No. Wump. Okay. I guess not. Not today. Alright, good job. Alright, let's check how fast those eyes can work. I'm gonna hold up a finger, okay? And you're gonna let me know how many fingers I'm holding up, okay? Alright. And good. That was on a finger. Okay, good. Eyeballs seem to be working. I'm going to take a little peeky inside if you don't mind. I'm going to use this good old-fashioned ophthalmoscope. I'm going to get real close, not make it too weird, and I'm going to take a look in your eye. If you can be a good little patient and follow my directions, that'd be great. Okay. All right, why don't you go ahead and look up for me. Good. Down. Good. Left. Good. All right. Very good. My other eyeball. Let's go. Same thing. Be a good patient. Follow instructions for me. So up, down, to the left, to the right now. Bring it back now. Gotcha, slide. Okay. Good little patient. Very good. Alrighty, we're gonna take a quick peek inside those ears of yours, though. You do seem to follow instructions pretty well, so I'm not too worried about a hearing problem. So just close those eyes. And I'm gonna take a little peeker inside here and see what's going on. Alrighty. Things pretty peachy keen in here. No problems, cool. And the other ear now, I'm just gonna poke around inside here. Wow, doesn't look like you're a Q-tip abuser at all. I'm not seeing a lot of earwax. Oh, you come in for a lot of ASMR ear cleanings, huh? Okay, well, I'm sure we can get you scheduled at the front desk that completely exists and get you on my completely non-fictional calendar. Cool. All right, everything sounds good. Looks good in the ears, but let's see how your hearing actually is. So I'm gonna have you close those eyes for me. I'm gonna whisper a word in your ear, and you're gonna repeat it back to me, please. All right, here we go. Just close those eyes. Toxicity. Good. Grubbin. Good. Melodic. Very good. Ente. Good. Melmetal. Very good. Sylveon. Good. Dragabolt. Very good. Urshifu. Tinkaton. Yes, Tinkaton is one of the best Pokemon, 100%. Very good. Alright, so you can go ahead and open those eyes. I think your ears are pretty good. Just poke around, check it out real quick. Yep. I know completely what I'm looking for here, for sure. Yep. Alright, all good there. Why don't we just do one more little test, just to make sure everything is good, especially with all that crinkly, crunchy thing you had going on. We're just gonna do a quick sensation test. I'm just gonna touch you with the dull object or the soft object, and you just let me know which one it is, okay? So we're gonna have to close those eyes for me. And again, let me know if it's the dull or the soft, okay? Okay, here we go. And dull, good. Soft. Dull, good. Dull again, yeah. Soft, yeah. Soft. Dull, good. Soft. Dull. Soft. Dull. Soft. Dull. Soft. Alrighty. Well, I think that your case of crunchy face is pretty much cured because I'm an awesome doctor. Let's just run around it with the brush real quick, make sure we're not hearing any more crunchy crunchies. God, look at me, I'm amazing. And you're an amazing patient, but I'm an amazing doctor. For sure. I got rid of your crunchy face. Completely made up in imagined malady, but look, you're cured. Which means that you're probably kind of sleepy, which means you need to go hydrate, get into some comfy clothes, and get into bed and go to sleep, okay? Alright, good. So, if if you want to get that ear cleaning on the books, just make an appointment at the front, and we will get you all booked up, and we'll see you again soon, okay? All right. Bye-bye.